If you have joint pain, especially after 50, put this down. Don't ever use any single another pill or other chemical medication like ibuprofen or similar kind of medication that you use each day. Because today, my dear viewers, I'm going to change your life completely in next 7 minutes. I'm going to explain perfect natural remedies that work even better than ibuprofen for your joint health. This is the hint of danger. Here is what your prescription bottle doesn't tell you. NSAIDs, ibuprofen, naproxen, diclofenac work by blocking the enzyme called COX-2. And this enzyme triggers inflammation. Block it, pain decreases. Effective, fast, but here is the problem no one tells a woman about over 50. After menopause, your gut lining is already thinner, your kidney filtration has already slowed, and your cardiovascular risk because of declining estrogen is already elevated. NSAIDs attack all three simultaneously. A 2060 study in the British Medical Journal followed women over 50 taking NSAIDs regularly, and the risk of gastrointestinal bleeding doubled with the 6-month. Kidney function declined 15% with 1 year, and cardiovascular went 40%. And you're taking drug designed for a 35-year-old body in the 15-year-old's body. This is better way, and it costs less than you ever imagine. Yeah, my dear viewers, those kind of medication, those pills had a lot of side effects and you don't realize it. This is especially important, you woman after 50, everything is in declining, and you have knee pain, hip pain, I don't know, spine problem, similar kind of condition, you swallow those chemical medication each day and you will be in a lot of trouble. I'm going to recommend you first of my 5 foods. It's going to be ginger root. In my clinical practice, ginger root extract is one of my first line natural anti-inflammatory natural remedies. And the mechanism, gingerols and shoggols in ginger directly inhibit both COX-1 and COX-2 enzymes. That exact enzymes ibuprofen targets. My protocol: put 2 centimeters piece of fresh ginger root in the boiling water, steep for the 10 minutes, drink every morning. You will feel different in 14 days. Yeah, my dear viewer, those enzymes that those chemical medications are attacked, you can attack with normal natural remedies. Ginger root is my recommendation number 1. My recommendation number 2 is going to be cannellini beans. These white beans are one of the most underrated anti-inflammatories in a clinical nutrition. They contain high concentration of quercetin and camphorol, flavonoids that suppresses inflammatory cytokines, especially TNF-alpha and interleukin-6. Those are the same cytokines trying your joint pain every morning when you try to open your hands. Protocol: 1 cup of cooked cannellini beans 4 times per week. Add olive oil. Don't overcook. The quercetin is hand sensitive about 100 disease. Did you ever heard about this? This is all scientifically proven. I recommend it to my patients. My third recommendation that block all those inflammatory enzymes in the same natural way, of course, is going to be turmeric. Turmeric, but most women buy turmeric powder, put in your food, notice nothing, and give up. And here is why: curcumin, the active compound, has less than 3% bioavailability on its own. It passes straight through you. And the secret is piperin. Black pepper increases curcumin absorption by 2000%. That is not typo, 2000%. And my protocol: 1 tablespoon of turmeric powder, a pinch of black pepper, and 1 tablespoon of oil. Heat slightly consumed daily. The fat increases absorption further. A 2019 study in Journal of Medicine Food found this combination reduced C-reactive protein, your primary inflammatory marker, by 28% in just 8 weeks. Everything is scientifically proven. Unfortunately, none of you don't know anything about this, but that's why I'm here for you. My fourth recommendation is going to be something called Mung beans. Lesser known, incredibly powerful Mung beans contain vixitin and isovitexin, 2 flavonoids that specifically targeted synovial inflammation. That is the inflammation inside your joint capsules. the inflammation that makes you stiff in the morning. In traditional Chinese medicine, mung beans have been used for joint conditions for 2000 years. We now understand the molecular mechanism behind it. Protocol: mung bean soup twice per day, or sprouted mung beans, even more bioavailable, add to the salad, is going to be perfect for you. And my fifth recommendation, this is also unbelievably important, and a lot of you of course already use it, is going to be extra virgin olive oil, especially cold pressed extra virgin olive oil. This is one of your grandmother's new but you couldn't explain. Olecanthal, a compound in high quality extra virgin olive oil, has been proven to inhibit COX-1 and COX-2 enzymes with the same mechanism as ibuprofen. The dose equivalent, about 3.5 tablespoons of high quality olive oil, equals approximately 10 milligrams of ibuprofen in anti-inflammatory activity. Not enough for the acute pain, but consumed daily, the cumulative anti-inflammatory effect is profound. Protocol: 2 to 3 tablespoons of cold pressed extra virgin oil daily on the salad, on the bread, on straight. Do not heat it above 180 degrees because you destroy olecanthal. This is so easy to understand, but of course, my dear viewers, those natural remedies does not work overnight. You must consume it regularly for the months through the year, and this is how you're gonna be happy. Not just drink this chemical solution each day and you get large worse each month. Let me know in the comments which joint gives you the most pain: knees, fingers, hips, spine. Write it below. Based on your answers, I create a targeted follow-up protocol for each specific joint. But I want to give you another my video. I want to know everything that you possibly can know about best natural remedies that are perfect for the knee cartilage. This video is right here. Thank you for following my video. See you next time. Bye bye.